Dear students, welcome back. In the previous session, we have discussed about patellofemoral joint articular surfaces and congruence of the joint. Now, in this session, we are going to discuss about the motions of patella. Here, the relative movement between femur, tibia, and the patellar surfaces during knee motion is more complicated than what a simple hinge joint represents. Okay, as the contact between the patella and femur changes, with knee joint motion. Okay, the patella simultaneously translates and rotates on the femoral condyles, and these movements are influenced by and reflect the patella's relationship to both the femur and tibia. Okay, so the motions of the patella based upon the relative movement between the femoral, tibial and the patellar surfaces. So the motions of the patella is divided into patellar flexion and extension, patellar flexion and extension. Next one is the lateral and medial shifts, or lateral and medial tilts also we can say. Okay, and next one is medial rotation and lateral rotation of the patella. Okay, so what are the types of movements? Patellar flexion, extension, medial shift and lateral shift, medial tilt and lateral tilt, medial patellar rotation and lateral patellar rotation. So these are the motions of patella. Okay, now we will discuss about one by one. So first we will discuss about the patellar flexion and extension. Okay, so when the femur is fixed, while the knee is flexing, the patella is pulled down. Okay, gliding inferiorly and rotating on the femoral condyles with the distal apex of the patella moving posteriorly. So as we know that, so this patella on the femoral condyles, it will move inferiorly and gliding posteriorly. Okay, yes. This sagittal plane rotation of patella. So this sagittal plane rotation of patella, as the patella travels down the intercondylar groove of the femur, is termed as patellar flexion. Okay, and knee extension brings back the patella back to its original position in the femoral sulcus. Okay, with the apex of the patella pointing inferiorly at the end of the normal range of motion. This patellar motion of gliding superiorly while rotating up and around the femoral condyles is referred as patellar extension. So these are the patellar flexion and extension. Okay, now we will see the next one is lateral and medial patellar tilts. Okay, yes. In addition to patellar flexion and extension, the patella will tilt around a longitudinal axis. So the patella is going to tilt around a longitudinal axis. Okay, now we'll draw the longitudinal axis here. Yes. axis. This is the longitudinal axis. Now this one is going to tilt, shifts medially and laterally in the frontal plane and spins or rotates around an AP axis which is perpendicular to the patella. Okay, here this bone is going to tilt medially or laterally. Okay, tilting about the longitudinal axis. Tilting about the longitudinal axis is termed as lateral tilt and medial tilt, and which is named for the direction in which the anterior surface of the patella is moving relative to the femoral condyles. Okay, the lateral patellar tilt occurs when the lateral edge of the patella approximates the surface of the lateral femoral condyle, then it is called as lateral tilt. Okay. And in the case of medial patellar tilt, when the medial edge of the patella tilt patella moves towards the medial femoral condyle, then it is called as medial patellar tilt. Patellar tilt is also we can call it as dictated somewhat by asymmetrical nature, okay, of the femoral condyles. Okay. For instance, the more anteriorly protruding lateral femoral condyle forces the anterior surface of the patella to tilt medially during much of knee flexion. Okay. So this is the thing happens in the tilting of the patella. Now we will see the next movement, that is lateral and medial patellar shift. So now we are going to discuss about the shifts of the patella. One is lateral shift and the medial shift. So lateral and medial patella shifts or translations, simply we can call it as gliding, that occurs in a plane of motion rather than any rotation around an axis. So here it is only gliding here. Okay, so a lateral patellar shift is defined as the patella moving, okay, towards the lateral femoral condyle, simply gliding. Okay, so just moving towards the lateral femoral condyle in the frontal plane along the medial lateral axis, then it is called as lateral patellar shift. A lateral patellar shift is commonly used during the patellar apprehension test to evaluate the stability of the patella within the femoral groove. Okay, so and next one, so if the patella shifts to medial, that means simply the patella will glides towards the medial condyle in the frontal plane, then it is called as medial shift. Now we will see the rotation of patella. Okay, normally the rotation of patella which takes place on anteroposterior axis, okay, and which is referred by the movement of the distal apex of the patella. So distal apex of the patella. So this is somewhat tricky here when it is called as medial patellar rotation and lateral patellar rotation. Now you can see. So the medial rotation occurs when patella spins around this perpendicular axis, that is the long axis. Okay, perpendicular axis with the apex of patella. So normally apex is almost pointing inferiorly, isn't it? Yes. The apex of patella pointing towards the medial femoral condyle, and base is, and the base of the patella moving closer to the lateral femoral condyle, and as the femur undergoes axial rotation on tibia. Okay. So here you have to understand that the inferior pole of patella follows the tibial tuberosity during medial rotation of the tibia. Okay, during medial rotation of the tibia, okay, the inferior pole of the patella follows the tibial tuberosity during the medial rotation of the tibia, which causes the apex, the base of the patella facing towards the lateral side. Then it is called as medial patellar rotation. Okay, if you see in the lateral patellar rotation, what will happen? The inferior pole of the patella follows the tibial tuberosity during the lateral rotation of the tibia. Okay, so then what will happen? So the pole, okay, the pole which is facing towards the tibial tuberosity follows the lateral rotation of the tibia, and the base of the patella is facing towards the medial femoral condyle. So this is called as lateral patellar rotation. Okay, so these are all the motions of patella. Okay, and the patella, although firmly attached to soft tissue stabilizers like extensor retinaculum, undergoes translational motions that are dependent on the point in the tibiofemoral range of motion. The patella translates superiorly and inferiorly with knee flexion and extension respectively. So understanding these motions is important because they can influence knee joint function during active knee extension. For example, if superior gliding of the patella is restricted, then quadriceps function can be compromised and knee extension may be lost. Okay, during active tibiofemoral flexion, the patella glides inferiorly. A restricted inferior glide could therefore limit the knee flexion. So there is a simultaneous medial and lateral shift of the patella that accompanies the superior inferior glide. The patella is typically situated slightly laterally in the femoral sulcus with the knee in full extension. As knee flexion is initiated, the patella is pushed medially by the large lateral femoral condyle. As knee flexion proceeds past 30 degrees, the patella may shift slightly laterally or remain fairly stable. Okay, and the patella shifts as the knee moves from full extension into flexion. Failure of the patella to glide, tilt, rotate or shift approximately can lead to restriction in the knee joint range of motion. And also the maltracking of the patellofemoral joint or pain caused by compression of the patellofemoral articular surfaces. Therefore, passive and active mobility of the patella should be assessed clinically to determine the presence of hypermobility or hypomobility with respect to the femur. Okay, this is all about the motions of the patella. In the next session, we are going to discuss about patellofemoral joint stress. Okay, thank you.